Why classic EMR vendors will be replaced by openEHR and AI agents architecture. This is an article by Bart, and it's been going around quite a bit, and a lot of people are talking about it. So let's get into it. A transformative wave is sweeping through healthcare, powered by the democratizing forces of open source AI and a growing resistance to monopolistic control. Now, this word is quite accurate in the case of a lot of EMR vendors, because it's quite hard to get out of these particular EMR vendors, and because they just lock you in, and you really can't get all of your data out. So sometimes just moving out means losing all your data. But let's explore. Let's explore how this revolution is unfolding and why it matters for everyone involved in healthcare, from doctors and nurses to patients and innovators. Traditional electronic medical record systems, EMR, the ones that make both doctors and patients want to pull their hairs out, are living on borrowed time. They are like the taxi industry right before ride-sharing came along, ripe for disruption. In this newsletter, I will explore why classic electronic medical record systems, vendors, will be replaced by openEHR and AI agents architectures. Okay, so now before we get to openEHR, for those of you who don't know what openEHR is, it's a standard for building electronic health records. That's it. It's a set of APIs on top of which you can do whatever. Like you can create your own data types. You can you can use existing data types in there. And using the API, you can basically do everything that an electronic health record should be able to do. And AI agents, to define it a little bit more strictly, I would say an LLM plus tools with the ability to do things out in the real world would probably be termed an agent, right? So an agent would just be LLM plus tools equal to agent. Yeah, I think that's a good definition. Let's see if Bart is going with the same definition here. The problem: monolithic giants blocking innovation. Imagine you're a brilliant healthcare startup with an AI solution that could save doctors hours of work each day. There's just one towering obstacle in your path: the existing electronic medical record system that dominate health IT. In the United States, a single company, according to many different sources, Epic, controls the medical records of up to 94% of the population. While Europe's landscape is more fragmented, the story remains similar. Large inflexible EMR systems act as gatekeepers, deciding which innovators reach healthcare providers. Now, this can't be, I don't think we can say it in a better way. I completely 100% agree with this. Sometimes, it's not even the EMR vendor gatekeeping. It's just like they don't care enough to allow other people to do things on top of the data that they have kind of accumulated. So it's sort of this, the practitioners and the patients, they are the ones actually doing all the work. They are, paying for it. They are literally going through scans, and they're collecting all of the structured information. But then the EMR vendors, they build the system, they implement it once, and then they start to become sort of these gatekeepers or owners of this data. And of course, I don't think this is fair. Yeah. Deciding which innovation reaches healthcare providers. And because, they have the say, and if you take a look at Epic, they literally charge per API call if you want to use some of their more proprietary APIs. And again, you can't get all the data that you need by using just the open fhir APIs, or so-called, the open APIs that they have. You mostly need to pay them a lot of money to actually get anything done. These traditional EMR systems have become more than just software. They are the primary interface through which healthcare professionals interact with technology. Unfortunately, they've also become barriers to progress, suffering from several critical limitations. Think of these EMR systems as ancient cities with high walls and no gates. Inside, valuable medical data sits in isolated silos, unable to flow freely between different systems. The systems speak different languages, data formats, making communication nearly impossible. They're as rigid as concrete, struggling to adapt to the rapidly evolving needs of modern healthcare. I like the style of writing. I'm pretty sure like Bart has used some AI here, but then it's quite I think there's a lot of editing that needs to go into like write properly like this. I would say this is a really good use of AI writing. I would say I'm pretty sure there is some AI in here which wrote some of this, but then it's well done. They're as rigid as concrete, struggling to adapt to the rapidly evolving needs of modern healthcare. And perhaps most frustratingly, they lack the sophisticated analytical capabilities needed to derive meaningful insights from the vast amounts of data they hold. So this again, like I see particle health. So let's jump in. The situation has become so problematic that we are seeing legal challenges emerge. Consider the recent case of particle health, which filed an antitrust lawsuit against Epic Systems, alleging that the company uses its market dominance to suppress competition and innovation. This represents a breaking point in the industry's tolerance for monopolistic control. I don't know what happened to this. Epic System stranglehold on US medical records harms patient care lawsuit. So they have a literal article on this. Put a link to this as well. Yeah, this is probably a good read. So enter the dynamic duo, openEHR and AI agents. Enter openEHR, a revolutionary approach to health IT that embodies the same spirit of collaboration and innovation that drove the open source software movement. Think of openEHR as building a new city with modern infrastructure, one where data flows freely, systems can easily connect and communicate, and innovation is welcomed rather than blocked. Now, it's again a good analogy. Like the old system is sort of like this thing set in concrete, and you're not able to do anything with it. It's like the walls are high, and you're not able to do anything. Whereas openEHR is sort of like this new modern city where the information flows freely, and you can easily connect from the outside and do what you want with the data rather than having some one person like block it. Leading this charge are companies like Better, Vita Group, Cambio, Code24, and MedBlocks. Yes. Nice. They're creating flexible modular systems that can evolve alongside healthcare's changing needs. But openEHR is just one part of the equation. The other revolutionary force is AI agents, intelligent systems that promise to fundamentally change how healthcare professionals interact with technology. As Microsoft CEO Satya Nadella recently observed, we are witnessing a shift where traditional user interfaces will give way to AI agents that can understand and respond to natural language, automate routine tasks, and provide intelligent insights. Imagine a world where instead of clicking through endless drop-down menus and checkboxes, healthcare providers can simply speak natural language to AI assistants that understand medical context, automatically document patient encounters, and provide real-time decision support. This isn't science fiction, it's the near future of health IT. I think this is already possible. This is, have you seen some of these demos? Like for example, this is a demo of Agent Care AI. So again, the MCP is a protocol for Claude to interact with other systems. So this is a really cool demo where they show how you can literally just interact with the Cerner system, and it's asking for like consent, and it's actually logging into a real Cerner system, and then it's pulling the data of Harris in this case, and literally like trying to pull all of the information from the system, and it's like showing you what is possible. Like imagine this, but then you're actually able to do everything that you can. So the problem today is not that this is possible. You already have the APIs to do this. This is like really possible even with Epic or Cerner or like the big EHRs. The problem is you can't really do everything that you need for patient care. So if you take a look at Epic on Fire, right? So Epic on Fire is again like a fire.epic.com. Let's take a look at what they have in here. So let's see. They'll tell you all of the different APIs that are available. So you can kind of like see the number of things that you can create. Like you can create allergy intolerance. You can kind of like read and search on most of these things. But then there are a few things that you can't really write back, and that is where the limiting factor is. Like you are not able to do what you want with this agent that you have. It's super powerful. It's able to do all of these things for you, but then it's not able to it's not able to do it. It's because the API is not available. So if you just look at like how many creates are allowed, it's literally just like 1, 2, 3, 4, 5, 6. That's, I shouldn't count that because that's just like different versions of the same thing. Probably like 10 different resources are allowed to be created, and everything else is just, you're just able to read the data back. So while something like this is quite cool in terms of it's able to maybe enable patients to look at their own data and understand what they can do, it's not very realistic in terms of actually interacting with an EHR system. Okay, so even here, like so it's literally writing code here that can sort of visualize what the patient is going through. So this is the data, and it's like building the agent or the AI is building an ideal representation of what this data should look like. And this is already possible, right? Like, this is already, this is an open source project available on GitHub. It's called Agent Care MCP. Okay, MCP stands for like Model Context Protocol that Claude introduced. So it's already here. I wouldn't say, it's not the near future. It's already here, right? Like what is not available is the limiting factor here is this API that we see here. Okay, like all of this API that you see here is the limiting factor of what an agent can do today. It's not, agents are like AI and LLMs are moving so fast, it's like mind numbing, right? So let's continue, right? The old guard is crumbling, the path forward. The convergence of OpenEHR and AI agents represent more than just a technological update. It's a fundamental reimagining of healthcare information systems. So here we have a nice little graph that shows how the classic EMR and how it will change with openEHR. And again, this is again something that we are already seeing, right? Like instead of just GUIs and form-based GUIs where you have to like click a bunch of things, an agent-based system would be contextually aware, right? Like, so you will still probably have things like you instruct it, I want to be inside this particular patient, and then it kind of like has systems and tools that it can use under that context, but it is not going to be like you clicking 100 times. Like it's going to sort of be like, okay, I want to be inside the patient. I want to be, I want to get access to all of my list. So it's sort of going to be like, have you maybe seen the domain model, for example, domain driven design domain? So if you like take a look at maybe some of the some of the diagrams here, it's a really good representation of what a contextual UI probably should look like. So let's say domain driven design. I'm not getting the thing right. It's called the context, I think. Yeah. So for example, here we take a look at the same exact thing. I think Martin Fowler is excellent at the articles that he's written on domain-driven design. Probably no one better than him. So if you take a look at a sales application, right? Like you are doing something with sales. Okay. So if you are in sales mode, the agent understands that, okay, you are in a sales context, and then it tells you what a customer is and what a product is in the relation to the sales context, right? So there is, okay, customer has a territory, a product has a territory, and then there's a salesperson under that territory, and there is opportunities and pipelines. So your model is within this bounded context of sales, right? And then you move this model to, let's say, the support context, and then it's now under it's the same sort of data, but then there is a different view to this data. Now, a customer and a product under a support context is only relevant in terms of a ticket created, right? Like who created this ticket, what is the product that they created this ticket for, and then they create a defect and so on. So I think this whole domain-driven design and having this bounded context and having an agent play in this bounded context is super important, right? Like you can't have an agent do useful work without it also understanding the domain and understanding the context of the domain. So this in healthcare would probably look something like inpatient care, or maybe outpatient care, or maybe patient follow-up, or just like, okay, take care of the chronic disease of a particular patient. So it's going to have these different bounded contexts, but then the agent in that context can just like play around. It can do whatever it wants. It can, it is so much more powerful than like clicking through a GUI. Okay. So the logic layer. So we have proprietary code that has like static business rules and so on. An AI agent can enable dynamic logic, adaptive workflows, AI agents. Like, again, you can have natural language be the logical layer, right? You can declare rules in advance that is able to like literally do things if you tell it to. So you can maybe program it as, okay, I want to pull the information that's related to this particular case. I want the blood pressure of this patient if he's hypertensive. I want what diagnosis was last done. I want all of his past medication charted in a nice way. You can just do that with natural language, and that becomes the logical layer, right? And the AI can like kind of operate on this layer. Now, here is where the main difference is, right? Like the data layer. So traditional databases have you can still use traditional databases. They support CRUD operations, but here private open data platforms. So this open data platform or this health data platform is kind of the holy grail. Like it should enable the AI agents to like do the queries that they need to drive these workflows, right? So again, I think you can still have AI agents operate on traditional databases because anyway, these private data platforms are kind of going to be based on traditional databases. They're not going anywhere, but you need a lot more now. Like you may need a vector store. You may need some constraint on what an AI can do, right? So some sort of simplification of the queries or some sort of validation of the schemas so that when the data comes in, you know that it's being checked against. So that layer, that open data platform is going to be what's hard to build. But then I think openEHR and all of these different architectures provide a very good answer. So this new paradigm promises to free healthcare providers from the burden of administrative tasks, allowing them to focus more on patient care. Enables seamless sharing of medical information across different systems and institutes. Foster innovation by creating an open ecosystem where new AI-powered tools can be easily integrated. And again, I think AI itself is almost like an infinite tool creator, right? So whereas in the old EMR paradigm, you would think of it in the sense of, okay, I can integrate this app that does this particular thing. It's now not that hard to ask the AI to generate this app for you and then just like validate it by one engineer. And then you are like, okay, cool. Now I have this in my arsenal. I can just have this AI generated tool be called by the AI, right? So that it gets into that level of where innovation starts like exploding, right? Like because you now have innovations that can kind of create new innovation and so on. So it's a good positive feedback loop. So finally, I think this is where the main thing is, right? You're able to improve patient outcomes through more sophisticated data analysis and personalized care recommendations. Given these advantages, it's puzzling to see major healthcare institutes like Berlin's Charité still opting for an EMR behemoth like Epic. Yeah, it's a like hot take on Berlin's Charité adopting Epic. But then a lot of people are still adopting Epic. They're like, okay, you know what? Epic is so much better than Cerner. So we have to go to Epic and we gotta spend millions on an implementation. But again, the future looks more and more like a simple technology-based data platform that is operated on by AI agents. I agree with most of what is in here, right? What I don't maybe agree with is the need for getting rid of a traditional database system. I think it still does. Maybe what I would do is I would put this traditional database under the private data platform here. So it would sort of like kind of move below here, and that would make more sense to me, right? So then you need this layer, but then you still have traditional databases. And like, see, I would just say I had someone from my fire bootcamp tell me that if someone doesn't use Postgres, I think they're not a decent person. So it's like people have this like very attachment, like they have a lot of attachment towards databases. And so much work has gone into optimizing this. So you can't really get rid of traditional, like databases anytime soon. So given these advantages, yes, it's puzzling this. So the time is now. We are at a unique moment in healthcare IT history. The convergence of openEHR's maturity, rapid advances in AI technology, and growing frustrations with traditional EMR systems creates perfect conditions for transformation. However, realizing this potential requires careful orchestration and new technological bridges. Exactly why, together with my co-founder, Mandana Ahmadi, a serial founder with a PhD in computational neuroscience, we have founded Isari. I hope I'm pronouncing that right. I think, they're is building something for sure. I think shout out to Isari and what they're building with AI agents on top of openEHR. I think there is definitely a lot here, right? A lot of innovation to be done here, a lot of work to be done here. So of course, we are interested in working with selected customers who share this vision so we can build together. While we are in stealth mode and can't share details of our work yet, we are excited to push the future of healthcare IT to an entirely new paradigm that can evolve and improve continuously and is based on openness. For healthcare providers, technology vendors, and most importantly, patients, this transformation promises a future where healthcare technology can finally live up to its potential to improve care, reduce costs, and enhance the experience of everyone involved in the healthcare journey. Feel free to contact me. Okay, I'll put a link to Bart's LinkedIn profile for sure, and as well as like the link to this article. I think it's a really, really good example of how things are changing really fast, right? And then it's just like so hard to keep up with the pace at which AI is improving. Like just like DeepSeek comes out of nowhere, and then like Quen comes out of nowhere, like just breaks every single benchmark of OpenAI or Anthropic. But I think, what do you think? Like, let me know in the comments. Do you think this is the future? Do you think like a doctor just walking into a clinic and asking, they're pulling out like a phone, or they're pulling out like, I don't know, it's probably going to look like a phone. But they have this Jarvis-like intelligence that they can like utilize. They just say like, hey, pull up my patients for today. Pull up my patient list for today. Okay, all of the patients who I have seen and I have done this particular thing, just mark them as discharged. Like you can do that, right? Like you are already able to do that with something like the MCP protocol with existing EHRs like Epic and Cerner. Now, you just got to think what is possible if you remove the constraints, and then you have an agent like operating on a full access EHR like openEHR, REST API, for example, right? So exciting times, exciting future, and I think openEHR needs a little bit more love than it's getting at this moment, and it's like it's growing quite fast, I would say, and a lot of people are looking at it in terms of, okay, we need a solution for storing health records in a standardized way, and openEHR is shining more than anything else at this point. So I'm actually conducting a workshop. I do this every month, and if you're interested and if you just want to know more about openEHR, do just like click on the link below and like join in. I'll be very happy to have you, and we can also like interact in the live chat. So the workshop is coming up, and definitely looking forward to seeing you there live. So that's about it for this, and see you in the next one.